All right, so it's 1 o'clock, so I think we'll get started here. So again, good afternoon. Thank you all for being here today. This is our fourth session at Coalition Bargaining for Healthcare. We appreciate you being here. It's been almost 2 months, I guess, since we last met. So we plan to review some of the slides we've previously seen and discuss some of our updated claims reports, get into any questions you may have, and then provide some time for the parties to discuss. I think you can see, at least I hope you know that our goal does remain to reach a negotiated agreement. Hopefully we're able to do that today or in a session pretty soon. So with that, I'll turn it over to Nancy Bolton, who's going to lead us through some of the presentation.
Can everybody see the slideshow?
Yes.
Okay. Okay, let me just dismiss that note. Okay. Okay, so just the topics to cover that we have planned for today are very brief. We're just going to update you on the plan performance as of June 30th and the rate projection update. And just recap where we ended up on June 20th, which was the district's rate proposal to cover projected premium or plan year 2025 funding deficit through 50-50 split. District premium comparison, just an update on that, and red line changes to bargaining articles. And then, of course, a discussion. So again, I'm always sorry for the small font. It's a lot of information. You were sent this information through email as well with an Excel spreadsheet. But June claims came in collectively at about $20 million, which was kind of middle of the road for this year. As you know, June can be a quiet month. If you look at years past, it wasn't in 2023 necessarily, but it can be a quiet month because people are traveling and enjoying their summers. So we, of course, are waiting to see what the July data looks like, and that should drop in a week or so. But it did smooth out the actuary's projection a little bit because the actuary looks back at a 12-month period. So they're not necessarily calculating their projections from January to July, but instead from July to July. So we still have those relatively light months in the projection. And so we shouldn't depend on that to think that the projection is going to continue to improve because the claims could spike again before the year is over. So here we are again with this unfriendly model, but the July projections that the actuary provided to us actually did show that additional funding just to break even for plan year 2025 is a negative 48 million. So that's the amount, just the minimum amount that we would need to cover based on that snapshot in time. Now, as you know, every month as claims come in and the year becomes more mature financially, that amount shifts a little bit. So we've been pretty much in the $50 million window. So we shouldn't hang our hats too much on that number, but the $50 to $55 million window is really what we feel most comfortable with in just breaking even. That doesn't correct our blue line here, which is our ending fund balance. But because as the actuary projected, we had the $29 million loss for plan year 2024. And of course, we've snowballed in the red a little bit as we project into 25. So Heather, did you want to take this one or shall I continue?
I can take it. So the updated forecast is $48 million. What Ms. Bolton stated is that will continue to fluctuate throughout the year because you saw that June was a little bit less but May claims were a little bit higher. So it's going to go up and down throughout the year. So it's going to be somewhere in the range, which is, what we were saying before, 50 to 60 million, 48 to 60 million. It really is going to fluctuate. July and August are usually high claims. So we're waiting for those months because that's usually when there's a lot of surgeries and doctor's appointments that are scheduled. So it is going to fluctuate. It is a forecast. So we do know that we're averaging, what our estimate is to look at that $50 million range and to recover around the $51 million to break even, which may or may not break even depending on what actual claims end up being. Whatever slight increase we receive over that break-even point would help to reduce that shortfall that we already have in our fund balance, which is the difference between what we're required to maintain by Florida statute and versus what we actually have. So we're looking at an increase of $212 per month per employee just to break even. And our last proposal, our last counter offer was splitting that 50-50. So it would be $106 per month per employee and $53 per paycheck, which was a reduction from our initial proposal. So Nancy, to go through the...
Yeah, and so here are just the rates illustrated. This is the monthly medical contributions as compared to where we are now with 110 right now for the high option employee only, for example, this first row, and just adding that necessary monthly increase to each premium tier of coverage, which is option one. Very simple, just simple math. I mean, it's not a simple issue, but it's simple math. And then we've continued just to illustrate for you option two, which considers more of an actuarial rate based on the fact that you as an individual, are worth a certain actuarial factor of 1. And then if you cover a child, it's less expensive than covering an adult spouse. And both of those are less expensive than covering a full family. You haven't indicated an interest in that. We've continued to illustrate it. But if you did want to consider that sort of funding model, we would look at the actual numbers in detail with our actuary. But this is a model that they helped us to create. So we would just follow your lead on your level of interest in continuing that study. And then this is just breaking down the pay period methodology, just the 24 paychecks based on your 24 deductions, and reduced if your members participate in health rewards, reduced $25 instead of $50, based on each paycheck, because it's $50 per month if they participate fully. And then finally, just again to share, I think that Broward is facing some challenges as well with their costs going up. Orange County did. Most of the colleagues that I've spoken to have talked about having to deal with increases and just challenges this year. But as you can see, we remain very competitive with our dependent coverage as compared to other districts. And so that's just how we've always subsidized dependent coverage. And so just that's something else that I think is worth illustrating to you all as how other districts have managed their increases over the years. And then finally, the updates would update the articles to the current date and to the board's monthly contributions once we've been able to agree to a full funding model. And that concludes the slide presentation.
Mr. Begg?
Yeah, can we go back to the slide that has the other counties on it, the other school districts?
Sure.
On that slide, are we saying, have they already come to agreement on this, or is this projected for plan year 2025?
These are actually,
Those are current rates.
yeah.
I did speak with Broward recently. I don't believe that they're have reached an agreement yet for future rates.
Sorry, just trying to get back to that
So
slide.
we say,
There it is.
so we say current rates, then Orange and Hillsborough, they've already agreed to the planned rate that we see on that slide.
Yeah, so the rates that are shown here are current rates in effect as taken from their benefits booklets. The orange rates were updated after I think that these rates were imposed on July 1st, which is their
with
plan
these-
year.
Okay, I'm sorry, Nancy. And with these, when we looked at the other districts, just so we have a apples to apples comparison, are these all self-insured districts, or are these districts that pay premiums to an insurance company?
Hillsborough and St. Lucie are fully insured districts, I believe. I just spoke with St. Lucie last week, and I believe they are fully insured. And Hillsborough is also. And they're insured through Humana, which is no longer in the medical business. So they're still contracted with them. I'm not sure how that will look over time.
Thank you, Nancy.
Yeah, I'm not sure if that means that the others aren't. I guess what you're saying is we're just not aware necessarily of who is fully self-insured or not, correct?
Correct, but Broward and Orange are self-insured.
Yeah.
And I believe Martin is, but I could confirm that. But as we've discussed with an agency our size, an employer our size, it really it's a cost-effective thing to be self-insured, because for years like this and for last year when we've had negative claims, we would have not only had to pay those claims and administrative costs, but also United would have taken a profit margin, and that would have been part of that calculation as well. Being self-insured, when we have good years, better than predicted, we get to keep those funds, which is why I think our surplus, our statutorily required fund balance was so healthy over that long period of time, because we had some good experience multiple years. So we were able to keep the money in our funds. And it also helped us to break even in these subsequent years since the pandemic, when our costs have exceeded our budget. It's just that we're going to run short of that next year, unfortunately.
But that's also why we were able to not have increases in employee premiums over that time period. Because if we were fully insured, we would have had an increase every single year of at least 5%. Most of our peers, when I would attend national conferences, it was closer to 10% when you're with a fully insured health provider versus being self-insured. So we were able to realize the fact that our actual claims were less than the national trends going forward, and the reason why we weren't having those increase in health premiums. Unfortunately, we weren't seeing that after the pandemic. It has been consistent. We did take a wait and see approach. It's unfortunate that the claims did not go back to those pre-pandemic levels. It does appear that they've somewhat stabilized, but now we have to catch up for last year as well as the current year. So we do have to have an increase in premiums. It's unfortunate, but that's where we're at. We have one bucket of money available for salary and benefits, and we, so whatever is used for increases in benefits is not going to be available for increases in raises. So that's where we're at.
And I think one of the things is by last year doing $10 a paycheck, we knew it was going to set us back even further, and it did. So now the situation we're in is just even that much more difficult, and we're afraid that if we don't get beyond this year and try to get back to where drastic increases aren't as likely, we're just going to keep seeing this kind of issue every year. We're going to be in the same exact position when we open up negotiations next year if we don't really get beyond this. But our thought is that if we get beyond this, maybe we can, get back to a more normal type of year going forward. So, any questions from the group? You'd like to just go into caucus?
Yeah, if we could.
Okay.
Thank you.
Everyone, I'll let them know you're back in.
Thank you, Caitlin. Gordon, go ahead and mute.
Hey, everybody.
Let us know when everybody's back, I guess.
I think we are. It's hard to tell. It doesn't show everybody, but
Okay.
I think we're good.
I think PBA had made a public record request or a record request for negotiations on behalf. Well, PBA made it, but we were all going to share the document for the actual actuarial report that the district is using as the basis for this year. And I don't think that we were able to obtain that as of yet. So that's kind of, I don't know if the district has any information on that, but that's kind of critical for us to make an informed decision about the district's assertions derived from that. So can we get an update on if that is available and when?
Well, and Nancy can send that over. I mean, it's not, I don't think it's what you think it's going to be. It's not a 50-page document. It's just going through, their actuarial assumptions, and it has the forecast. So that is an easy document to provide. The request was quite voluminous. And so that's why we were trying to work on all parts of it as to what we do have versus what we don't have. We don't have any information, claims information that's by employee, because that's not how we track it. That is a HIPAA violation. So we don't look at any of that information. So all the documents that we will be providing will be at the, what we look at in order to assess the plan, which is at the rolled up level all claims. So we can provide piecemeal parts of the request. And I think, Nancy, if you want to give an update, those are the actuarial reports are easy to provide. The monthly claims report, because it's derived from the monthly claims report. You've been receiving the monthly claims report since, I believe it May of 2022. I believe you've been receiving that information. So, those are easy documents to provide. So Nancy.
The actuary sends what they call a forecast every month. And they have recently changed it in the past couple of months at our request, and it's really voluminous in data. They break out active versus diabetes health plan versus retirees. So it's a lot of data, but you'll see in the first couple of slides, the negative 48 million that we're referencing. And you'll kind of see that month over month, the numbers that we've been reflecting to you in bargaining. So we had worked on pulling all of that following your original public records request. But there was some of the information you wanted required some time on staff. And so that's where we were.
Do they I'm sorry, Nancy. Did they update that also with retirees and people who leave the district who were probably like the more I would say older group who may use more of the benefits to be more accurate, I would say, and how often is that done?
So we do have retirees in our plan, the 62 to 65-year-olds. And when a retiree turns 65, they are then transitioned off our plan and onto the school district consortium Medicare supplement plan. And so we have about 500 retirees at any given time, and we have to extend that benefit. It's the full cost for retirees, but Florida statute compels us to continue those benefits without a break in coverage to retirees if they choose to opt.
Well, the question, I think, Nancy, is the reports that we received from Wells Fargo, does it break out retirees as a separate bucket to know that, how much are their claims versus their premiums? But
that's correct. Thank you, Heather. But also about the ones who are dropping our insurance now after they leave the district. Not the ones that are staying on but the ones that are actually dropping. So if a person leaves in December, do we count them from December through June? Or are we using that body here still? Or once they're done, they're done?
Once they're done, they're done. Unless they elect for COBRA, but then for COBRA, they would be paying the premiums on that, but it would only be if they were eligible and they elected to continue with COBRA. But we wouldn't, those I know are not tracked separately on the report. I'm not sure if the retirees are, but I know, like Ms. Bolton said, that partly was a cost saving measure, taking off the retirees that were over 65 because they do not impact our health plan. The consortium is not part of the district health plan. So it's only now, it's down to 500 retirees out of 20,000 members in our plan that are actual retirees. So that was a cost-saving measure. It was not popular when we shifted those retirees that were at the age of 65 onto another plan.
I think they're doing well with it, though, aren't they, Leanne?
Right. Yeah, right. Initially, though, it wasn't popular just because of the unknown.
And the change, yeah. I think they might pay a little bit less for the Medicare supplement if they get on there at 65. I mean, it goes up as you get older. But yes, the newly presented actuarial report has a lot more data. And I know it certainly breaks out the retiree enrollment. I'm not sure about the actual claims, but if that is there, we'll make sure we point out what page to go to. But the actuaries do look at that implicit subsidy with those post-employment benefits and how much those cost the plan. So that's an actuarial report that we've received that would probably.
Nancy, I'm sorry to interrupt, but I didn't want to confuse the actuarial report versus the monthly claims reports that we receive.
Oh, right.
The actuarial report is a very short report that is, built on all of the claims data. The claims report is the one that's voluminous. Is that what Nancy is talking about? Because we give what we've been reporting since May of 2022 is just the total claims. This report breaks it out by the different plans. Mm-hmm. So it rolls up to the same numbers, but it's just a lot more detailed. But that's not really, I wouldn't consider that the actuarial report. That's just the claims data. Unless I'm remembering, what I'm remembering is not correct.
We just want to make sure those numbers match on both sides, though, too.
And I know that these things take time, so thank you for bearing with us. But yeah, if you could give us both of those, the actuary and the claims data, and then I'm going to meet with the reps because they want to see all that. And then we'll talk about it, and then we can get back to you guys because I know that each group they have to meet with their reps and vice versa. So we'll just get back to you once we have that, and then we can discuss that info and then think.
Yeah, so I just wanted to make it clear that, because the reason what was taking time is we don't look at it by individual employee. So that was, a lot of the requests were related to that. And so we were determining whether that's possible. And it's ultimately, we don't feel that it's accurate information. And then we're also had concerns about HIPAA violations as well. So as long as you're amenable to the reports that we receive and that we actually have, which is the actuarial report as well as the monthly claims reports that we're receiving. That's by plan, but it's not, none of it is by individual employee.
Yeah, that's fine. And I responded to Jean. I don't know if she's on here.
We just looked at that. Yeah,
okay.
We just looked at that response.
Is there something additional we could share today to keep discussions moving forward, or?
I think we just want to see, because it's really nice and it helps a lot, the PowerPoint, but I think they actually want to see what you guys use to make that and look at it on their own and then talk about it so that we can give a more informed answer.
Okay.
Well, just know that really is coming from the information we have been sending since May of 2022. It's from the total claims.
We understand.
Just want to reinforce, we've been giving it since May of 2022.
Easier to have it compiled, I think, especially since this is what we're talking about now.
Well, the monthly forecasts that we receive that are detailed that the actuary creates from the claims data will not be compiled. They're individual monthly reports. And then there's, the state filing that the actuary creates. But I'm not sure what is compiled is the claims report that we provide, but it doesn't include all the administrative costs and all those other things.
Month report.
So just to clarify then, and if we need to put it in writing, and this will be from CTA, I don't want to step on the toes of the previous request made by PBA, but basically CTA would like every single piece of documentation produced by the actuary and provided to the district, which is subject to public records in its original source.
Right, which will be a PDF. So that's how we receive it, is as a PDF.
Okay, we appreciate that.
So just one, I guess, so are we saying we're not coming back with any additional proposals?
No, I think your proposal was the same, and we just want to get that information to speak with our different groups before we respond.
Okay. One of the things that, I think we might want to consider thinking about too is I know it feels, first off, I would like to get a meeting scheduled as soon as possible. It's been almost 2 months since we last met. We do hope to, reach a negotiated agreement as opposed to, continuing through the impasse process. So, we are on a deadline, and it is kind of difficult to meet that deadline with even starting as early in negotiations as we had. So but one of the things to even consider as you guys are working through your thoughts and, you know, and where you think we land is, you know, we're probably open to some sort of 2-year agreement as well. So if there's, you know, fear of it, you know, going into 2025, not knowing if 2026 will be just as high or something like that, we're willing to entertain a lot of different options here to try to reach an agreement together. So I know as you work through your proposals, keep that in mind and consideration so that we can maybe bang this out for you know, at least this upcoming, at least plan year 25 and maybe 26. So.
We appreciate that.
All right. So I'll have Caitlin reach out to everybody to go ahead and try to get another session scheduled. You know, giving some time for you all to review the documents that we're going to provide from the actuary.
Okay.
Sound good?
Thank you.
All right. All right. Thanks, everybody. Appreciate your time today.
Thank
Great.
you.
All right.